We can see the future now that the vaccine is here. And finally, there is some hope. Parents and grandparents, our loved ones, can get vaccinated now, and we'll be right behind them. Hartford residents can schedule their vaccine appointments today by calling Hartford Health Department at 860-757-4830. Let's protect our community by getting the vaccine. Hartford, let's fight COVID together.
And there it is. We are live. Welcome, everybody. This is Oscar Arango and Jendaya Miller. How are you?
Good, and you, Oscar? Glad to see you again.
Glad to see you again as well. We're happy to have this conversation. We really need it, right?
We do. But I do know that since my last visit, I know several people that have changed their mind and went ahead and got the vaccination.
We really need to talk about the vaccine, so we want to welcome everybody. So thanks for being here. We are live right now through CT and Vivo Facebook page, and also the Facebook page of the Angel of Edgewood.
Yes, Angel of Edgewood. We have had a busy week. We had a huge food drive yesterday on Edgewood Street for Easter, and last Thursday we made 300 Easter baskets for students at Freddie Wish Community First School and some shelters. So we've still been busy.
Busy week. So welcome, Jendaya, and thank you for being with us. We definitely have this conversation. We have neighborhood conversations. Thank you to the city of Hartford. And of course, we have to say thank you to United Way, Central and Northeastern Connecticut, because we're having this conversation about the vaccine. What vaccine is better? Have you heard that before?
I have. I actually had a conversation this morning with someone who feels as though Pfizer is the best choice. Some people want Moderna. So there's different stories out there floating around. So, we'll get into that as well.
Absolutely. So we do have two guests today that are going to help us to understand a little bit, what's going on with the vaccine here in Connecticut. This conversation, we call it myth versus fact.
Yes.
There's a lot of people talking out there, what is good, what is bad, but we really need to hear from the doctor.
Yes, we do.
Right?
The experts.
Those are the ones that know the information, and we trust them. So let's welcome to our both guests. One of them is Dr. Valerie. There she is. Of course, she is Dr. Valerie Brutus, and she works in Hartford Healthcare. She's a breast surgeon. So welcome, doctor.
Thank you. Thank you so much for having me.
I'm going to let you introduce, our next guest who's coming from New Haven. Of course, can you put it on I want to see him on camera. I want to see him on camera. I want the close up, please. Bernard. Hi, Bernard. Welcome from Care in New Haven. How are you?
I'm well. Glad to be back again. So happy that I was contacted and was asked to come back again. So glad to be here.
Bernard McLean from Care in New Haven, our partner here on this conversation. So we are ready to start, this conversation. We have multiple questions, and we want to invite everyone. If you have questions, we are live. So make sure you type your question, and Dr. Valerie will answer the question for you if it's related to the vaccine.
Absolutely. I'm ready.
You ready?
Yes.
Doctor, are you ready?
I am ready.
Of course. All right, so let's just start with the first question, because we definitely have it here. So let's just start with the first question. I know as we read the question, we're going to be talking about it, and I know you will have something to say. Bernard will have something to say. So, doctor, this is the first question. If you can put it on camera, please.
Yes.
Wow. Excellent question.
Why is that?
So this fact was raised, after the CDC published a report with the data that they got with their vaccination health checklist, monitoring side effects. And about 78% of women were reporting side effects, but I have to say that 90% of the side effects are mild. But of course, the question was, are women having more side effects? What's going on? And, it sort of started a lot of other questions. So I think first it's important to realize that the majority of questions were answered by women. So 78% of women answered the survey versus 31% of men. So whenever we have cancers like this, and so it's hard to say, well, are we selecting more women because they answered more versus men? So there's also that part that we have to keep in mind. But this is not something that's been new. There's been other studies that's been looking at side effects of vaccine in women, and there's been some studies that suggest that women can have more side effects, and we don't know why. So there's multiple theories. So one of them is that women's body process vaccine different than men. Another theory that's been also studies too is to say that women have different what we call sex hormones, which are estrogens, and other hormones that are higher than men. And since these hormones can sometimes bind to the surface of the immune system cells, that they can interfere to how the cells may react. Also, some things that's been studied too is that women have two different chromosomes. We have the XX chromosome, the man has the XY chromosome. And some of the chromosomes that are related to the immune system are present in the X chromosome. So it's something also about the genetics of women that can sometimes affect the immune systems. So there's definitely a lot of data to support that women react differently than men with vaccination. But I think the most important thing that I got when I reviewed this data is to say that 90% of the side effects were mild. And what were they? There were headaches, lightheadedness, some tiredness, so nothing, really crazy. And the majority of the side effects as well, they went away, after a few days or so. So it's not to say that women should be careful not getting vaccinated. This is not the point. It's just to say that it seems to have more side effects. But is it because more women answered versus men? We're not really sure.
That's great. Great answer. A lot of information, and we love that. So I guess, our viewers might be thinking and questioning themselves right now. Doctor, did you get the vaccine already? And any side effects after you got it?
Oh, no. I got my vaccine since January. And the side effects that I had was, after the second dose, and it's nothing crazy. My arm was a little bit sore. I used a cold compress. Within a day, I was fine. I had a little bit of a headache. I took some acetaminophen, which is Tylenol, and I was just fine. So that's what I had in terms of side effects. As a breast surgeon, I have a lot of my patients, were women, and when I talk to them, also the one that got the vaccine, most of them reported either no side effects or very mild side effects.
Perfect. Jindaya, what about you? I know you got the vaccine already. You got the shot.
I got the shot.
Tell us about it. Any side effects? Tell everyone that is watching us right now.
Actually, I did. I've only received the first one. I get my second one this Saturday. I had the Pfizer vaccine. I felt some tingling and burning, but I took some Benadryl, and it seemed to be okay after 24 hours. But I hear some people say it makes them extremely tired, but I work so much, so I don't know if I was tired from the vaccine or just my everyday tired. But so far, good. I'm feeling good. I'm confident. I trust the doctors. I trust the experts. And I just want this pandemic to be done so that we can get back to our lives.
Perfect. We need more people to get vaccinated. We need more people to get the shot. So Bernard, down there in New Haven, it happened the same thing? Women were complaining about getting more side effects?
I thought that was an excellent question. And you know what? It's funny that through our listening sessions, we interviewed a number of New Haven residents, and a lot of them were women that were vaccinated, and we didn't get that. So to hear that question and then hear such a great answer to it, I'm going to bring that question back to my own team. But no, I have to say, no, that's not something that I've heard of here in New Haven. And I've been vaccinated myself. I got the Johnson & Johnson, and I'm perfectly fine. I didn't feel anything.
I did too. I did get the Johnson & Johnson last Thursday, and it's been perfect.
Yeah.
Like nothing happened. So I'm fully vaccinated with just one dose. Right, Bernard? That feels great.
Right, one dose. But to hear that question, with the men versus women and how it affects men, and you know what? I'm sorry, that question never came up, and I'm just amazed by it, but it's good to know. So I'm kind of going to throw that question out to our next group of listeners to see if that's something that is actually happening here in New Haven that just haven't been mentioned before now.
I
Perfect.
know.
You know
So
what?
what
We're
we
looking at
should
the.
do is
Yeah, go ahead, doctor.
definitely. I think what we should do is encourage everybody, men to answer, when you get this safety vaccine about, how you're feeling afterwards, the more people that responds, the better data we can collect. Because this report did mention that 74% of women answered versus 31% of men. So we have more women answering. So definitely, it gives a little bit of a bias there. So we would like for everyone to answer question about COVID vaccine side effects, and we'll have more data and we can compare.
One thing that I've been hearing a lot in the community from people who have or haven't been had the vaccination, that they're saying they feel like most people who experience side effects are people who had COVID. So now my husband and I, we received the vaccine the same day, and he had much more severe side effects than I did. Although he didn't officially be diagnosed with COVID, we do believe sometimes back in December of 2019 when he was sick and the symptoms that he was experiencing before everything about the pandemic came out, that it could have been COVID. So, we've experienced the side effects with him, and from what we've heard from those who have side effects after getting the vaccine once they had COVID has been consistent with what he dealt with last week.
Well, we really are, thinking here that the best thing is that the vaccine, even when people are still doubting about it, right?
Right.
Doctor, we have the second question for you, and hopefully we get an answer for it. Can we have the second question up on the screen, please? Because people are people are smart. People are smart. People are asking questions right now. So there's a question that says, we have been told that the vaccine are for everyone, but now we're seeing some places turning away people because they don't have an ID. What to do then? Doctor, what they should do if they don't have an ID, because I guess everyone needs to identify themselves, right? It's important.
Well, this for the state of Connecticut, you actually don't need to have an ID or you don't need to have health insurance to get vaccinated. So yes, when you can come to some vaccinated site, they might ask you for ID, and this is to verify, if people have registered or not, so you can verify your identity, or if you have health insurance. So this is sometimes what they ask you to provide, identification. But if you do not have an identification, if you don't have health insurance, you should still be able to be vaccinated.
Well, but if you do not have an ID, how they're going to put your name on that, card, right? The vaccination card and the record. How are they going to put your name?
So I know that the FEMA was setting, mobile clinic, and they were offering vaccine with no ID, but I think most clinics are asking patients to bring identification to get the card so at least they can have proof of vaccination. But as per the state guideline, you not having an ID does not forbid you to not receive the vaccine.
There you go. Bernard, what about in New Haven? Have you heard anything? And I really want to hear, for each question, your input from down there in New Haven. Have you heard about people getting turned away because they don't have an identification with them?
We've never turned anyone away. Every person you vaccinate is just one less person we have to worry about. But we give the cards based on the patient giving us the information. So, you kind of hope that they're not lying or who they actually are. But again, if they aren't, we're not going to turn them away from being vaccinated. We haven't done that here.
Let's hear from Jendaya, the north end of Hartford.
A few things that has come up in conversation about the identification is if someone is a criminal, they may have a warrant and be wanted by the police, and so they are afraid of tracking purposes. The other thing is vaccinations that are given in two parts, making sure that they receive information on these people so that if they get lost or don't come back for the second part of the vaccine, a lot of them, especially the homeless population and people that are just floating, don't have phones, just keeping up with coming back, or maybe they may not be able to get back to that location. So there's several things that are circulating in the community as to why ID is an issue.
Thank you, Zendaya. So we want to jump into the third question. And again, we're having this neighborhood conversation, like myth versus fact, because some of these questions might sound crazy to you. Like, really? People ask those questions? Well, people do. Look at this question. Why do we have vaccines with 2 doses and another vaccine with just 1 dose? A lot of people are asking that. Dr. Valerie, why is that?
Well, that's a very good question. It's a very good question. It's just that, different vaccine works in different ways. And right now in the United States, we're using, 2 different types of vaccines. So we have the Pfizer and the Moderna that, uses a technology that's called messenger RNA vaccine. So these vaccines were studied to receive 2 doses, in which the second dose, this is where you get to more protection. And the second vaccine that we're using, which is a Johnson & Johnson, is what we call a virus vector vaccine. So it's just different ways of vaccine are constructed, but at the end, they both do the same job. We both get protection from both vaccines. Both of these vaccines cannot give you COVID because they're harmless. They just help your body build immunity to protect you from the vaccine. But that's why one of them works in 1 dose and the other one works with 2 doses. It's just a technology behind these vaccines that they're different.
Bernard, I think you want to add something to that question, but I want to ask you, you got the Johnson & Johnson. Did you feel like you were not going to be protected as the other people that got the Pfizer one?
Not at all. I think, basically what we're sharing with people is you have 3 different companies sharing a vaccine, and all companies are saying, and what we hear from all of them is that no matter which one you take the one that's available to you at the time that you're getting vaccinated. And the Johnson & Johnson vaccine was available at the time that I was able to get it. Even though the percentages coverage is different between Johnson & Johnson and the other 2, but because I still feel that it's going to keep me out of the hospital, and of course it's not going to kill, then I'm not going to die from, if I so happen to catch COVID. That was my concern. But because I'm not concerned about it, I took the Johnson & Johnson. And I think we share that with everybody. Take the one that's actually available to you at the time that you are able to get vaccinated. And the result should be the same, as it's already been shared by a doctor.
Bernard, do you know how you have to end? Basically saying, and here we are.
Hey,
right?
And here we are.
I'm right here, perfectly fit. Talking
Absolutely.
to you right now live on Facebook. Talking to you. Get vaccinated.
I had the Moderna because that's what was available to me, back in December, and I'm fine. All of them are effective. All of them are safe. So it's exactly whichever one is available to you. If you want to get vaccinated, please get them because all of them are safe.
Dr. Valerie,
And I'm gonna be very honest. If I can say this, I'm gonna be very honest. I heard that I don't know if it's true, because I'm not a doctor, but I heard the side effects are less with the Johnson & Johnson than it is with the other 2, because the second shot was a lot worse than the first. So I took 1 shot, not worried about the second.
That's great, Bernard. Go ahead, Zendaya.
my question is for Dr. Valerie. One of the topics in the community is the life expectancy of the vaccines.
Yes.
This is going to be something yearly like the flu. We hear some stories about the Pfizer vaccine only lasting 6 months and people will have to do it again. What do we know so far?
So far, we are not sure because this is a new disease and this is new vaccine. And that's why, the CDC and all these other companies with the vaccine are trying to collect as much as information as possible for after vaccination to then determine, what's going to be the next step. So these are things that we don't know yet if it's going to be something that we have to deal for a year or every 2 years. We're not sure. And that's why, I want to stress out to everybody, if you have the vaccine and you get this messages afterwards to share, your side effects or your questions, please do, because this is the way that we can gather information, and then that will help us, in the future know what's the next step, or how to, the more information we have, the more we can generate data and come up with good answers.
Thank you.
Exactly.
Perfect. That was a great answer. So now let's remind everybody that is watching us right now. We are live through CT and Vivo Facebook page, and of course the Angel of Edgewood Facebook page. Please, if you have any questions, type them here in the chat, because we're going to be asking those questions to Dr. Valerie. She is a breast surgeon from the Hartford healthcare system, and of course we're having this conversation thanks to United Way of Central and Northeastern Connecticut, and of course our partner New Haven, Care New Haven. Now let's go to the fourth question, okay? Because these questions are great. So let's go with the fourth question, right? They are. So let's put it up there so people can see our fourth question. Look at this. I didn't have any side effects. Is that okay? I'm afraid the vaccine is not working. That is the fourth question. What do you got?
I would say,
go ahead, doctor.
If you don't have any side effects, that's great. So side effects are things that sometimes can happen, so we don't expect everybody to have side effects. Some people don't have side effects. Fine, some people do. If you don't have any side effects, that doesn't mean in any way or shape and form that the vaccine is not working. It's just the way that your body's reacting, and you don't have any side effects. That's great, but yes, is it still effective?
I think that comes with like so many conspiracy theories and things that you hear on social media. And so, one person puts something out there, everyone latches on. And so they focus so much on the side effects and have blown it all out of proportion that's what they stick to. So now it's almost like if you don't get sick or you don't have any side effects, that it doesn't work.
I know Bernard was laughing as well with that question. Bernard, what were you laughing?
No, because we hear that all the time, and you have so many people trying to bring peace to people by saying that if you feel the side effects, that it shows that it's working. And I think that's a bad message to put out for definitely the person that brought this question to light, because I would be just like him in that effect, that, because I didn't have any side effects. So I'm thinking that it did not work. So I'm not thinking that, but that's what people are saying too. I say, well, that lets you know that it's working. And I think that's a bad message to put out. That's why I started laughing.
Absolutely. And it was great. And thank you for saying that, for mentioning that. Actually, something that I was going to say, this is a serious matter. COVID-19 is serious. COVID-19 is killing people, and we have to be honest about it. And people need to understand that the vaccine is the only thing that can prevent you to go in a hospital, right? That is the only thing. So we have to remember, everybody that is watching us right now, that COVID-19 is serious, but this is the way we should talk about this, right? We can talk like we're in the living room at home, right? Talking like this.
Right. Because there are still a lot of deaths. Although the numbers have gone down a great deal, there are still a lot of deaths and people who are contracting it every day. So, we still can't get uncomfortable with losing the mask and not practicing hand washing and anything else. It's still so important.
Absolutely. Doctor, I know you were going to say something.
No, absolutely. And I think it's great that we have these conversations, because unfortunately there's a lot of myth, and I think people are afraid, to get vaccinated because of that. And it's just, I cannot stress enough how important it is, because this disease so far, has taken way too many lives and destroyed, so many families and so many other things. So it's just a way, if you can protect yourself, I would encourage everybody to get vaccinated. We're doing this to give information. So, we're trying to educate people as much as we can, so you can make an educated decision about being vaccinated.
Absolutely.
And people need to understand, and what people need to understand is that they still need to do the preventive measures by washing their hands, wearing their masks, even though people are getting vaccinated, because COVID is still very present and it's going to be present way after vaccination. So, one thing I don't want to feel, even though I might not die or I might not go to the hospital, I still don't want to feel the effects of the COVID virus. I still don't want to, come where I can't breathe or, I can't function. I still don't want to feel what that feels like. I don't want to be one of the statistics that it happened to. But basically, from hearing from people that it actually did happen to, so still practicing those safe measures are so important, and we're going to be doing that for quite some time.
Absolutely.
Definitely we will.
One quick thing I wanted to ask Dr. Valerie, that's a huge conversation in our community as well, is the 6 feet versus the 3 feet social distancing. And so I guess the concern is that although many things have begun to open back up and the capacity has increased, how does that 3 feet rule affect those who still haven't had the vaccine or don't believe in the vaccine?
Because even people have mentioned about the HEPA filter, with the 3 feet. Who's that, doctor?
Yeah, so that's the part that's always going to be a little bit tricky to answer. I'll explain to you why. Because if you are vaccinated, you're protecting yourself, but you don't know about other people who are not vaccinated. And it's not only from COVID. You also have to think about your people who have other disease or are more vulnerable to get COVID and have complication from COVID. So when I think about, the 6 feet, is like, well, this was studied when we didn't have the vaccine, everybody had to wear masks. So now we can say, if we're able to vaccinate more and more and more people, so we can certainly try to decrease, the distance, but we're still going to be protecting ourselves and practicing, the safety measures. So that I think for now, that's what's recommended. You still wear your mask, you still take precaution with washing your hands, and you try to be as careful as possible, because we have not vaccinated enough people yet to say, oh, we're done. We're not there yet. We have a lot of work that we still have to do.
All right, perfect. So let's jump into the next question. We had so many questions, and people right now in our Facebook Live pages, are submitting those questions. Now, so I had COVID-19 already. Does that mean I can just get one dose? Interesting. What do you think about that, doctor?
I would say no. It depends on what vaccine you get. If you're getting the Johnson & Johnson, that's the dose, you get that one. But if you're getting the other, you want the Pfizer and the Moderna, the effect was studied with 2 doses. So I would say if you get Johnson & Johnson, it's 1 dose. If you have the Pfizer and Moderna, you have to get the 2 dose, even if you had COVID in the past.
See, there's a lot of misinformation out there, but I'm glad, I know we are having this conversation, because no question, it's crazy. No question is, what else you can say about those questions?
Well, one of the things I was just going to ask Dr. Valerie about, that's a huge conspiracy theory, is that no one has the flu anymore. And I wanted to know if she could touch on that.
Yes, definitely.
That's my specialty. Well, I can't believe somebody. Go ahead, Doc. I'm sorry.
No, I'm happy to answer this question. It's not to say that nobody had the flu anymore. It has to say that yes, the numbers of flu this year has decreased drastically. Why? Because people were wearing masks, people were indoors. We were not socializing. So of course, if you factor all this in, yes, the numbers of flus have decreased. But it's not to say that the flu had disappeared. Not at all. And that's why, getting vaccinated is the best thing, because if we don't vaccinate enough people, and then we are next fall, next winter, and then people are outdoors and we have the flu that's there and we have corona, it's going to be very, very, very challenging. So that's why.
I think what makes them think this way is that many doctors' offices doesn't even carry the flu vaccine anymore. They don't have any vials, even when it was, the height of flu season, before any of these things. So that's, when more conspiracy and different things come into play,
Right.
because it's like, they did this to us. This is the government making us sick. So they're not pushing the flu out like they did with COVID. So, there's so many rumors out there, but I think a lot of people were afraid and believed and were able to believe in these things when they went to their doctor's offices and they were turned away and said, we didn't even order them this year, because my doctor told me that as well.
All right,
Well,
perfect. Thank you.
I'm sorry to say, I always get my flu shot early. So I got my flu shot, back in October, because I rather do it earlier than later. So I was, it was okay. But I think it's because, we were indoors, we had masks, and we were not socializing. So when you're talking about this disease or transmitted, through airdrops, there's definitely going to be a decrease if we practice these safety measures.
Right.
Absolutely. Let's jump into the next question, and thank you for talking about the flu as well, because I remember people were getting confused at the very beginning talking about the flu and the COVID, and now with the vaccine itself. So now look at the question. I took the vaccine, but I don't want my young kids to take it. I'm afraid that they will have fertility problems or problems during pregnancy. Doctor.
So that's a very good question, and I get this question a lot. So far, there's been zero evidence at all that the COVID vaccine affects fertility, or affects pregnancy. So the CDC published a studies recently where they had a small number of women who were pregnant that got the vaccine, and they had no reported side effects. There was women having issues, no babies having issues. So of course they're watching this very closely, and they expect to get more and more patients as we're vaccinating more people. But so far, nothing has shown to cause any issues with pregnancy or to cause any problem about getting pregnant. Actually, the American Association of OBGYN, which is obstetric and gynecologists, encourage women who are, thinking about getting pregnant to get vaccinated. Because the reason is, when we had studied women who were pregnant, who had COVID, the pregnant women had higher chance of complications and higher chance of dying than the non-pregnant women when they were affected with severe COVID.
All right, so let's jump into this one, and I want to thank Maria Virginia Oyola, because she just submitted a question live. She said they need, well, it's not a question, this is more like a comment. They need to open more places for vaccine. People, everything is full. Oh, okay, so they need to open more places for vaccine. People, everything is full now. Hard to make an appointment. Why do you guys think that, things are looking that way right now? A lot of people are calling. On April 1st, people 16 and plus, that is 1.3 million people in Connecticut are available now to get the vaccine.
Yeah, and my daughter-in-law actually said that to me before I left out the door today, that she took her a while to get in to make an appointment, and she's in Hartford, and they scheduled her this Saturday in Wallingford.
Perfect. So, Doctor, I know you want to say something about that. You want to add something, because I know it's not a question, but it's a comment. This is what people think. We need more. They're telling us to go get the vaccine, but they're not answering the phone.
Well, I'm glad to this comment, and I know that all the hospitals, including Hartford Health, are doing everything they can to open the more sites as possible to offer people vaccination sites. So I would tell people, go to the CDC.com. The Department of Health of Connecticut, also have information about getting vaccinated. This is where you get the latest update about new vaccine appointment and vaccine clinic. So these are the resources that you can use to know what sites are open.
And I think it's so important. Is working day and night, opening new locations. Yes. Pop-up locations, even in the last week, so many have opened up, and we see the ads on Facebook and They're everywhere. So I try to push them out and share them as well, so that people don't feel like they have to go so far, because a lot of the health organizations are right in their backyard.
And so I think, what's happening here in New Haven is the faith-based pastors are opening their churches to have the room to host vaccinations. We even have some of our art galleries that have opened up vaccination clinics for people to get vaccinated. Our mobile vans, and I think the state is going to mobile vans all over your area connect. So people just need to make sure they're making the right connections, watching the news, going on Google to Google different places that are actually opening up vaccinations in your community. Just don't wait to hear it. Begin to investigate, begin to look and find these vaccination clinics that are opening up all over your city. Here in New Haven, we have them everywhere. I mean, there's literally one coming up, one or two or three of them opening up every other day somewhere. So people will have that opportunity to go to those clinics to get vaccinated a lot quicker than going to maybe the hospital or the health centers.
Yeah, the mayor in Hartford Healthcare just had a press conference just a couple of hours ago before I headed here, listing new vaccine locations and how many are opening up, and the partnerships that they're building to be able to get vaccines to everyone quickly as possible. So definitely watch the news.
Yeah, and we want to highlight that the city of Hartford are moving ahead with these vaccines. And actually right now you are looking at the mayor of the city of Hartford, Luke Bronin, getting vaccinated last Thursday on April 1st, the day that marked the day that people from 16 and older could get the vaccine. He went exactly to the Public Works building and got the vaccine right there. That's where the images they're looking at right now. So let's ask another question, Doctor. It says Edna Costa Borchetta. It says, my husband had a mild reaction 8 days after his Moderna shot. A red mark at the injection site. Is this normal?
Yes. The side effects are at the injection site, where you can get, a little redness, a little pain, a little discomfort, and this usually go away. So we tell people, if it gets bigger or it's become more bothersome, then of course you have to let a healthcare provider know. But having a little red mark, at the vaccination site a few days after that goes away, it's nothing to be concerned about.
Okay, there you go. That's the answer right there. I know a lot of people are chatting right now with us on Facebook Live. I know you have some comments right there.
Tiffany from Plainville said, it is so difficult to book families 4 or more appointments. For example, ×2 for 2-dose appointments. It's a challenge for working parents with children in school. They'd like to hear about options, clinic options that will accommodate these families in these situations.
Yeah, and again, this is probably not a question for the doctor, but this is the what people is talking about. This is the conversations that everyone is having at their houses right now, right, Bernard?
Yeah, I mean, it's going to happen. And I'm going to tell you right now, with so many people that have to get vaccinated, I'm sorry, you're going to run into some issues with that. That's when the conversation needs to happen with the family to choose the right site, the right vaccination. I'm not saying that if you want the 2 vaccinations that you shouldn't be able to get it, but if one like the J&J is more obtainable for you with a family of your size, I would say do that one, because all 3, remember, all 3 are just as good. It don't matter which one you get. So if you have a large family, you may consider, and I'm just going to say consider, it's your choice to get the J&J, or just continue to stay on top of the place where you got your vaccination the first time to make sure you can get back in with your family to get the second shot. I mean, we know we have to give you the second shot if you choose that particular vaccine.
Absolutely. So now let's go to another question, because I know this is probably one of the questions or topics you guys have talked about in your own house, for those that are watching us right now. So which vaccine is better, Moderna, Pfizer, or Johnson & Johnson? I know we talked about earlier, like, get whatever is available, get it. But which one is better, doctor?
They're all equal. The purpose of this vaccine, all of them, is basically to train your immune system, that if you get exposed later on as COVID, your body knows how to fight this virus. So there's not a vaccine that's better than the other. All of them or all of them are fine, and all of them are safe. So I think, what I'm hearing sometimes is some people are more concerned about the Johnson & Johnson because it's a newer vaccine and it was just recently approved, but there's nothing to be concerned about. They're all equal, they're all safe, they all will do the same job. So I would say at this time, especially where people are having trouble to get appointments, whatever, if you want to get vaccinated, whichever vaccine that's available, I would encourage you to take it because all the vaccines are safe and they work.
Awesome. Jessica from Hartford said that she's not against the vaccine. However, she's not comfortable with receiving it due to hearing and knowing people who received both doses and still ended up getting COVID. Also, to her understanding, there are some vaccines, since there's a variety of them, that only protect for 6 months. How can someone such as myself trust even getting the vaccine when these things are happening?
Could I answer that? Could I jump in? Could I just
Please
jump in?
do.
Let me say this. First of all, the vaccines are not a cure, so you can still get COVID even after being vaccinated. What we're saying, and I want people to hear me clearly, we're not saying that if you get vaccinated that you will never get COVID. Any vaccine that you use with the flu, shingles, a lot of other ones that are out there, doesn't mean that you still won't get those things. What we're saying, if you get vaccinated, what we're trying to prevent is you're dying from COVID or being hospitalized because of COVID. So that's what these vaccines are for. So I'm not going to sit up here on the call today and say that you're going to be totally cured, after you get vaccinated. That's not the truth. But Doc, please step in and kind of confirm that.
No, I agree with you 100%. So the vaccine is not a cure. The vaccine is something it's like a layer of protection. And why, the studies in the vaccine shows that, people that were vaccinated, if they get COVID, we didn't have anybody dying, from COVID after we were vaccinated and the vaccine was working. But I think that the question, where people sometimes get confused is that you get your dose of vaccine, so you have, your first dose, you have some protection, then you're going to get your second dose, then it's going to take a little while before your body is, fully protected and able to fight the viruses. But in between, can you get COVID? Yes, you can. The same way you can get COVID after the vaccine. But, it's just decreasing your chance of dying or having what we call severe COVID, where you're in the hospital, you're in a ventilator, you can breathe and have so many other problems. So this is where the vaccine, offer you that protection. And I understand that people are afraid to get the vaccine. That's fine. We do this to give information for people and I feel like the more information that people get, the more comfortable, they'll be able to get vaccinated. So that's why it's important to have this conversation.
And the last thing
very interesting. Go ahead, Bernard.
And the last thing is, you have to make a quality choice. And the choice is yours. You get it, you don't get it. But if you choose not to get it, what is your next option? What are your options for not taking it to prevent yourself from ever getting COVID, a serious touch of COVID? What is your plan? What do you plan to do? What is your next steps? And those are the things that you have to think about. You have to think about the people in your home. You have to think about your neighbors. And you have to think about the people at Walmart, Stop and Shop, Rite Aid and CVS and Walgreens. You have to think about everybody that you're going to come into contact with. So what is your plan when you think about it from that standpoint?
Next is a two-part question. The first is, we know that there's new strains that have been found in Connecticut.
Right.
One is the one that came over from New York, and people are interested in knowing what is the medical community doing so far to get a jump on it, since the vaccines they're being told don't work on the new strands. And secondly, which vaccine is most compatible with pre-existing conditions, for example, asthma, food allergies, or prescription medications. Several family members in Tiffany's household have these questions because these are issues they're facing.
Okay, so for the first part, of the questions about the different strains of COVID who are in the community. So the vaccine do offer some protection against the strains. So currently, there's been a lot of work that's been done by, a lot of the scientific community to come up with the vaccine, and they're still actively working, with these different strains to see what's going to be the next step. But if you get, the COVID vaccine, you have some protection, from the other strains who are currently in the community. So that's one. The second part of the questions about, pre-existing condition or different medications, or food allergies. So I think, these are all great questions, but so far the vaccine has not been, if you have a pre-existing condition such as diabetes, hypertension, or heart disease, just because of that, you can get vaccinated. So this is not something we're going to say, oh, because you have a pre-existing condition, it's not safe for you to get the vaccine. No, this is not what's been said. People with pre-existing condition can get vaccinated, and the vaccine is safe. Same thing for different medication that you're taking. I think it's not good to generalize to say, oh, if you're taking medication X or Y, it depends. But so far, the vaccine has been safe in people taking medication, with the question of people having different allergies. So the vaccine that are used so far, they don't contain latex, they don't contain eggs. Most of the vaccine ingredients are available online. So a lot of the things that people used to be allergic to, in prior vaccine has been not used. And that's also why when people who get the vaccine, there's at least a 15 minutes, window where you get the vaccine, you're being monitored. And this is, to say that if someone would have, an immediate side effect from the vaccine, that somebody is there to assist you. Now, other question that comes when people say, well, I get the vaccine, I'm 5 minutes, but what if I go home and something happens to me? Well, if you're not feeling well, I would say call 911 or call your doctor so they can see how you're doing. But that's also why, there is the post-vaccination safety assessment that you get text message, you get email, where we're actively asking, how are you doing if you're having any side effects from the vaccine. And this is how we're collecting information, to share with everybody to say, okay, we vaccinated millions of people and the side effects are mild, or this is what we're having, this is what we're expecting. So this is what's important. But I think the vaccines are safe, and people with pre-existing condition should get the vaccine. People that takes medication, should be able to be vaccinated. If there's some specific medications we're aware, if you have bleeding condition, that's separate. Talk to your provider about it. People with food allergies it's safe for them to get the vaccine.
Are physicians suggesting one brand over another for individuals who have pre-existing conditions?
No, right now we're not, suggesting any vaccine preference for one over the other.
I love it. Thank you for asking all those questions. And everyone that is watching us right now, thank you so much. Before I ask my pretty much last question, I want to invite everyone on the right corner on the bottom. It says share. We want to get this Facebook Live and video to everyone that is watching us, or those that are not watching us right now. So we want to get to all those people. So please share this video. And as our last question, a lot of people were saying, like, should I get vaccinated or not? What is the answer right there? Please speak from your heart. We already said that the COVID-19 is killing people. We know that this is preventing people to go, to a hospital, or preventing from death. So why people should get vaccinated, doctor?
I think they should get vaccinated to protect themselves, to protect their family, to protect their communities, because we've seen so many people's families scattered, that so many people died from this disease. And if you can protect yourself and protect your community and your family, why not, especially if it's safe? So I would say for these people who have concern, it's fine, educate yourself. That's why we're having these discussions, is to share, information. The CDC, all the states, have vaccine facts versus myth in their website. So I would encourage people to go in their website to get this information, and that's the way to go. But I would say I got vaccinated. I have a small child. Certainly did not want him to be sick. Plus, I didn't also want to contaminate my patients. And I didn't want to contaminate my family, and I didn't want to have COVID either. So that's why I choose to get vaccinated. And I trust the vaccine, and I know they were safe.
Thank you, Doctor. And Bernard, last month we were talking about, like what was people saying out there, But today we're talking about the vaccine. Right now it's a different story. So why do you think people should get out and get the vaccine?
I mean, I think the doctor answered the question very eloquently. When you care about yourself, starting with you, when you look in the mirror and you care about yourself, you want to make sure you provide to yourself everything that's going to give you the quality of life that you want to live. We're in a pandemic that has interrupted that quality of life, that freedom that we want to have, that brook of normalcy that we live for, to be able to walk in the park, to be able to go to a restaurant and not worry about somebody breathing on you or speaking to you and giving you COVID. Um, for many other things. So when you think about, all of those things that this pandemic has taken away from you, do you want that normalcy back? Do you want a normal life again where your kids can go on to play in the park and do all those, go on vacation and don't have to fight the airport for being able to take a flight and all the things you have to go through when you come back from the flight or when you get to where you're going because of COVID? You want those things back. You want your life back. And this is just one small step to some
And
form of normalcy.
in the words of Bernard, what is your plan?
Hmm.
What is
That's
your
his
plan?
line. What
Yeah.
is your plan?
What is your plan? I mean, what are you gonna do if you don't get it? You gonna stay in the house? I think we're learning from our kids right now, being at home and not in school. I mean, do you want your kids to go back to school? Let's be real. Yeah, you want your babies back. You love them, but you can't wait for them to go back to school. Let's be real. And so you want all of those things back. So what do you do to get back to some form of normalcy? You got one small step that you can take to begin that process. And we will only get to that process a lot quicker than later. But right now it's going to take even longer as long as people fight against it.
Jindai, at the very beginning, when the vaccine was being distributed in Connecticut, the numbers showed that Latinos and African Americans didn't want to get the vaccine. What's the message today when the vaccine is available to our communities? What's the message for them?
I would honestly say I want everyone to get the vaccine, but I don't want to be disrespectful of anyone's beliefs. Therefore, I would tell them to continue to do their research by relying on their medical professionals, incredible resources, and just try to do what's best for you. I know in the African American community, it's sort of disrespectful to say what they need to do, especially knowing the history and what their beliefs are from many years ago back to slavery. So, I'm very sensitive when I talk about the vaccine with people in my community. But I want everyone to live. I want to see them. I want to get back to normalcy, hang out, hug again, all the little simplicities of life that we miss.
Absolutely. Thank you so much.
Definitely.
So I just want to thank all. Bernard, you want to add something?
No, I just said definitely. No, I disagree with you.
Definitely, of course. So thank
I
you.
would like to add, yeah, I would like to add one more thing. I completely agree. We're all here to encourage people. We're here to share information. But I think, what I found reassuring is that there's been more than 100 million people that's been vaccinated in the United States, and more than 500 million vaccine given worldwide. So when I look at these numbers, it's I feel very reassured to say if we have so many people in the U.S. and around the world, who are getting vaccinated, I think it speaks a lot for the safety and the efficacy of the vaccine. So I would encourage people to educate yourself. If you have concerns, I think you should speak up and try to find answers. And you should do something that you're comfortable to do. But I do think that you have to be your best advocate, and you just have to keep educating yourself and try to do the best you can.
Absolutely. Dr. Valerie, we want to have you back. Bernard, we want to have you both back here. Next time, right, Jendaya?
Yeah, I think next time is going to be really informative, especially since we have all of the new locations opening up. So we'll have more feedback, more data, and more information to bring to the neighborhoods.
Of course, and I want to remember everybody.
Do your research.
Do your research.
Yes. Send us questions. Do your research.
Not
Do your
Wikipedia.
research.
All right, and please, if you live in Hartford, remember you can call the 860. It's easy. 860-757-4830. 860-757-4830. Make an appointment and get your vaccine. I know a lot of phone calls, are going through those numbers, including the VAM's phone number, and a lot of people are not getting an answer. But please be patient and wait for your turn. And as soon as you get a call back from someone, please ask for your appointment and get the vaccine. Anything, Pfizer, Moderna, or Johnson & Johnson. Thanks, everybody. I want to have everyone on camera, please. All right. Thank you so much. Thank you both. Thank you, our partner in New Haven, Care New Haven, Dr. Valerie Brutus, breast surgeon from the Hartford Healthcare System, and of course, the City of Hartford and United Way of Central and Northeastern Connecticut. Thank you so much, Jendaya.
Thank you.
All right. Thank you, everybody. We'll see you next month on another conversation. Bye.
Bye.
We can see the future now that the vaccine is here. And finally, there is some hope. Parents and grandparents, our loved ones, can get vaccinated now, and we'll be right behind them. Hartford residents can schedule their vaccine appointments today by calling Hartford Health Department at 860-757-4830. Let's protect our community by getting the vaccine. Hartford, let's fight COVID together.